Hi there and welcome to another tutorial. This time we're going to be looking at the concept of cardiac output. We're also going to spend a bit of time looking at blood pressure and the two types of blood pressure. But before we start, we need to make a recap to make sure we understand what the concepts are that are involved with cardiac output. The first of those is heart rate. Now I've already done a video on this elsewhere which you can easily navigate to check your understanding of heart rate, but we do need to make sure that we have that understanding of what heart rate is. Here's the question: what is heart rate? And as we've seen already before, heart rate is the number of times a heart beats per minute. Don't forget to include the units, the beats per minute. A little bit more detail: one beat is one contraction and one relaxation of the heart, and a little bit further detail: 72 beats per minute for the average adult. Okay, so remember we're talking about cardiac output. First part is cardiac output is heart rate plus or multiplied by another concept which is on the next slide. Concept is stroke volume. Now this could be a question itself on its own: what is stroke volume? So let's have a look at what that is all about. Now stroke volume is the amount of blood which is pumped out of the heart in one beat when the heart contracts. Now if you think about volume, think about the amount of, think about volume for ventricles as well. You can think of those concepts put together. It's the amount of blood which is pumped out of the heart or the ventricles in one beat when the heart contracts. Again, a little bit more detail here. It's measured in milliliters, and again, on average, 70 milliliters is ejected each contraction. Really important point that you want to get your head around is the fact that during exercise, as we exercise, so stroke volume increases. Okay, so now that we've got the idea of what heart rate is, we've got the idea of what stroke volume is, if we were asked the question, what is cardiac output, hopefully we'd be in a good position to answer that successfully. Another favourite area of the exam board is blood pressure. It's important that we have an understanding of what blood pressure is, so I wonder if you're able to answer this question. Why don't you pause the video now and give yourselves a chance of answering this question before we move on. What is blood pressure? Now I'm imagining maybe a 2-mark question on this, simple recall if you like. What is blood pressure? Well, if we just look at the detail, we can see where we can get to perhaps more points. It's really important that we remember that the blood pressure is the force of blood pushing against the walls of the arteries as it's pumped around the body. It's important to remember it's the arteries because those, of course, are the blood vessels which carry blood, high pressure blood, away from the heart. That would be our first point, is the force of blood pushing against the walls of the arteries. Secondly, we might want to take it further and say, well, it's measured by measuring milliliters of mercury, and you can see there mmHg. And now taking it further, we might be able to answer it by saying that there are two readings. There's the systolic and the diastolic heart blood pressure, and we're going to look at each of those in a moment. But systolic, as you can see, is the contraction of the heart, and diastolic is when the heart relaxes. So you could well be asked for more detail to test your knowledge and understanding about what each of the blood pressures are. The first of which may be, what is systolic blood pressure? So let's have a look. Okay, so it's important to be aware that there are actually two readings when we take blood pressure. The first of which is the systolic blood pressure. As you can see, it's the higher of the two blood pressures recorded when the heart contracts. Okay, it's the first reading when we take blood pressure, and for example, it might be 120/80, and 120 would refer to your systolic blood pressure. Moving on then, you could equally get a question which asks you what diastolic blood pressure is. Now, given what we've just said a few moments ago, you should be able to answer this question with confidence. What is diastolic blood pressure? Maybe pause the video again, have a go at answering this, and see what we come up with in a moment. Okay, here's your perfect answer. I would suggest it's the lowest or the lower of the two blood pressure readings when we take blood pressure. It's the second reading when we're measuring the blood pressure, and again this would be the 80 in terms of 120/80. Again, if you can remember the measurements, the units, millimeters of mercury, that would be even better. And here's a question which I've added, which isn't directly related to blood pressure, isn't directly related to cardiac output, but nevertheless it is an application question related to the heart, so we may as well tackle it. Simply, as you can see, what happens to the size of the heart with exercise? What changes, usually possibly long-term changes, take place to the heart with or as a result of exercise? Okay, and in this response there are some key concepts that you might want to be introducing in your answer. You can see as we exercise, the heart gets bigger and stronger. You might want to take that further and say, why? Why is that? Well, that's because the walls, particularly the ventricles, get thicker. And this is called cardiac hypertrophy. That's a really good phrase, bit of terminology for you to use. Cardiac hypertrophy means the thickening of the ventricle walls of the heart. Cardiac meaning heart, hypertrophy meaning thickening of the muscles. You might also want to take that further and say, look, a strong heart leads to a lower resting heart rate and an increase in stroke volume. Take some time to get your head around that last concept there, and if you get a question on the effects of exercise with the heart, if you introduce some of these points, you ought to be doing well in this kind of question.